Today I'm going to be talking about your acne treatment support products, aka how to survive the first 6 weeks of acne treatment. Now, 6 weeks is pretty much a skin cycle, and over that time, if you started an effective acne program for your skin's going to be through a lot of change. So that can mean that you're dry, that you're a bit irritable. It can mean that there's a bit of a purge and your skin might actually break out more than usual. Lots of things will be happening. And as important as using the right agents to correct your acne, I think it's imperative you use the right products to support you through this troublesome time, because this is the time where if you're not using the right support products, you might lose faith and stop treatment before you even begin to see the benefits. I think it's a bit like personal training. It often hurts before it gets better. So think of this first 6 weeks as being analogous to starting off a training program that you know is going to be helpful long term. So some tips to help you stick with the program. I think it's vital that you have a moisturizer that you're comfortable using. And it may be that you need more than one, that you needed one for drier days when your skin's a bit more irritable, and one for oilier days whenever actually you just need a little bit perhaps around your eyes and on your cheeks. I'm going to talk through some of my preferred choices in a second. The next thing that you might experience is that not just dryness or a bit of roughness appears. You might actually get red, you might actually get sore, because most actives for acne, especially the more effective retinoids and ingredients like benzoyl peroxide, can trigger irritancy, especially in the adult acne population. And I see patients in their 30s, 40s, and even 50s with acne. So the nature of the skin changes, and therefore the potential for irritancy increases. Now, the important thing to do if this happens is to stop. Remember, this is a treatment process that's happening over months. So missing 1 or 2 days is really not going to matter in the bigger scheme of things. And ultimately, applying active products to already frankly red and irritated skin is just going to cause more problems. So stop, reset, reduce the quantity, and reduce the frequency of your application of your active steps. If that doesn't work, the thing to do then is to think about reversing the order of the product. So after cleansing, my general advice is to apply your therapeutic agent next onto cleansed skin to maximize penetration. However, if that's problematic, you can flip it and put moisturizer on first to seal the barrier, and then apply your therapeutic agent afterwards. It will slow down penetration a little bit, and it might take slightly longer to get to your endpoints. But it means you can tolerate treatment, because if treatment's not in your skin, it ain't going to have any effect on your acne. Now, in this period of time, it may well be quite hard to make sunscreen work in your routine. Sunscreen often doesn't tend to adhere terribly well when the skin is a little rough and dry. Now, my feeling is that unless you're in direct sunlight, it's best to get your confidence built up by simplifying your routine for that first 6 weeks. So if it's really not working for you, I think it's okay to skip it, provided you're not outdoors in the strong hours of the sun, and wait until you're into cycle 2 and 3 of the skin, because you will need a sunscreen long term, because you're likely to continue on long-term retinoid use, and the two go hand in hand. So let's talk about some products that are going to make your life easier. Now, when it comes to moisturizers, I have my favorites. And as I said, I think you do need some flexibility. I think you need to learn to moisturize based on how your skin feels on any given day. Our skin is drier if we haven't slept so much the night before, or if we've taken on board too much caffeine or alcohol. And then there are times in the month, particularly the week before your period, your skin will feel a little oilier and it will need less moisturization. So know how your skin feels and understand what it needs on that basis. So some of the ones I like, and this is quite a personal choice. I give my patients a lot of choice because I think it is quite an intimate decision which moisturizer and sunscreen you like the feel of, because ultimately if you don't like the feel of it, you're not going to enjoy using it, and compliance is going to become an issue. I find that this one from La Roche-Posay, which is called Tolerian Riche, is a great option for those who are perhaps normal to combination but getting a little dry once they've started using therapeutic acne products. And it's great for around the eyes and on the cheeks. So that's a nice one. And if that's a little too rich for you, the Toleriane, which is a lighter textured product, is also good. There's also one called Effaclar H by La Roche-Posay, which is very light and good for those who are sort of really more at the oily end of the spectrum, because they will still need a little bit of barrier support once they start an effective treatment program. For men, I often find that this works an absolute treat. That's just a basic one from Cetaphil. Their moisturizing lotion, cheap, cheerful, it comes in a big vat. And there aren't many people who don't find that effective, easy to use, non-clogging and non-irritant. For those who need a little bit more oomph, and I have to admit that when I'm using Retin-A, which I do on a regular basis, I need a little bit more from my moisturizer. My go-to is a Bagi Hydrate. This is a product we can't literally keep enough of in the product. People start buying it in twos and their boyfriend starts stealing it, because it really is an amazing moisturizer. It's got oomph, it sinks in readily, it doesn't create a greasy film, it doesn't clog you up. And I think it's a really good product for negating the drying effects of ingredients like benzoyl peroxide and retinoids. A good alternative, which is a recent discovery, is this one from Epionce called their Medical Barrier Cream. A similar sort of texture to the Hydrate, and contains an interesting blend of oils that help support barrier function and minimize the inflammatory change associated with some of the more irritating ingredients in acne management. So those are moisturizers that I find ease the pain a little bit, and I think it's completely fine to use more, especially where you need it. It's not uncommon for people to get irritated on areas like around the eyes and on the neck when they're using acne treatments, and that's especially true for adult acne where it comes right down onto the jawline and often onto the top of the neck. It can be very challenging to get enough active product on there without causing a red rash due to the sort of eczema type reaction to the ingredients. So I find that that's a particular place where applying your moisturizer first after cleansing before your treatment cream will just make it that bit more manageable. The same is true around the eyes. If you find that you're accidentally moving product around and actually getting it around your eyes cause a little bit of redness and puffiness, put moisturizer on like a raccoon, literally, before you do your treatment steps morning and night, and that will act as a barrier and stop you moving product around. So then coming on to sunscreen, which, as I said, is an inevitable part of your treatment plan. It has to be. These are my current favorites for acne-prone skin. A tinted sunscreen works really well as a city type block, because physical blocks do sometimes have a whitish grey cast. These ones don't. And these are two great options. The Jan Marini Physical Protectant is slightly warmer in tone, so it's a little better for darker skin tones. I find it works well on Mediterranean and Asian complexions. It's an SPF 30, but it's well formulated and actually delivers a higher number than that. That's just an EU regulation thing. It's been labeled an SPF 30. And then this Neostrata one called Sheer Physical Protection. This is great for fair skins. It's one I'm really loving wearing at the moment. And again, zinc oxide and titanium dioxide are the active ingredients in there. They're both quite matte in terms of the finish. They won't make you oily. They don't make makeup disappear. And they adhere really nicely, so the little white balls of doom don't tend to be a problem. Guys love this one. So this is the Helio Care Gel SPF 50. Again, it's non-clogging. It does come in a tinted format, and it sits really well on skin without any of that sort of nasty oiliness that sometimes can go with higher sunscreens. So that's a good option. And then my final one, just as a non-tinted physical sunscreen, this is the Epionce Ultra Shield SPF 50, which contains 10.1% zinc oxide, non-clogging, a light lotion texture. It's really quite amazing for something that offers so much protection. The texture is really forgiving and it's highly water resistant, so it's great if you're on holidays, you're doing sports outdoors, or also prone to pigmentation where you want sunscreen to really stay put. So those are my tips to helping you survive the first stages of an acne treatment program. You need to be prepared. It really will stand you in good stead to get to that elusive 3-month goal where you can really see where your condition's going and how you're responding to a treatment. So get your support products, put them on, try not to analyze your skin too much the first 6 weeks, and you'll get there. See you soon.